right, we've been talking about tax reform. Well, it turns out a deal to repeal and replace Obamacare could be alive and well. There are reports today that there could even be a vote as early as Wednesday. And there's a plan out there that apparently is going to get a lot of conservatives, all those Freedom Caucus members, on board. This would be very important because it would set the stage for tax reform. Gerri Willis has the details on this developing story. What can you tell us?
Trish, that's right. We have the details of that new legislative plan to save efforts to repeal and replace Obamacare. Republicans have been looking for a plan to bring an elusive 15 to 20 additional votes to support that bill that failed less than a month ago now. This effort, led by a moderate Republican Congressman, Tom MacArthur, and with sign-on from the conservative Freedom Caucus, would do the following: place a prohibition on denying coverage due to pre-existing medical conditions. You couldn't do that. It would guarantee coverage to all applicants and also the renewability of that coverage. Now, this is a sticking point for some Republicans who wanted continuous coverage only for those who managed to pay premiums on a regular basis. And the amendment would also allow dependents to be covered on their parents' plan up to age 26, as you know, Trish, a popular element of Obamacare. Importantly, states would get waivers from some of these federal standards in order to lower premium costs and get more people insured and really get some of those Freedom Caucus members on board. Now, one of the elements that could be waived is essential health benefits, that list of 20 or so elements that have to be covered under Obamacare, like addiction. The negotiations are happening, though, even as insurers across the country are beginning to estimate the cost of their plans for 2018. The news not good for consumers. Half of the insurers say they plan to raise rates from 2017 levels by 10 to 20%. The uncertainty surrounding the health care law and health care inflation are driving those hikes. Another 25% say they will raise rates by more than 20%. Get that? And 25% say they will raise rates by less than 10%. By the way, none of the insurers, zero, said they would keep rates at the same levels of 2017 or lower. Trish?
Such a mess. Well, let's hope, Gerri, fingers crossed, they get something done. Thank you. Thank you so much.